Hey, GLP-1 Plus SideZ community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus SideZ Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus SideZ Podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus SideZ Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus SideZ Podcast. You're not alone. It's not your fault.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster. Confidence higher. Price cheaper. See if you qualify at ro.co/TV.
Mm-hmm.
And so she said, Mom, she said, one of the most powerful things that he said to us in one of the classes that he taught was, he said, I am human because you are human. And if our world could really buy into the notion of humanity, and that humanity is diverse, that humanity is it's rich with uniqueness and opportunity and all of these things. If we could buy into it in that way, as opposed to fear and fear mongering, is like, oh, I don't know, she's got 2 heads. Like,
Totally.
You know what I'm saying?
Yes.
As opposed to being like, help me understand, like, how did you get 2 heads? Like, I'm not trying to be funny, but how did you get 2 heads? Let's talk about it.
Yeah, absolutely.
But that is not the energy that we are often living in. It's not.
Absolutely not. And I think that, like, I've had, so I have many siblings, and I have a couple of my siblings are I would say in the queer community, and for sure, there's a certain level of, I shouldn't have to explain this to you. You just need to kind of figure it out. But then I think that a lot of times people don't know where to go because there's so much misinformation out there. Mm-hmm. So I wish there was a way that we could some way understand each other a little better, because I do want to understand. I do want
exactly.
to,
exactly.
Because I don't ever want to be, and that's what I said when we were working on this at this company I was at years ago, we were building out DEI. I was like, I just don't ever want to say, and now looking back, I know I have done this,
Mm-hmm.
I don't ever want to say something to make people feel less than they are, because I'm ignorant, because I'm human, because I'm full of bias and all things. I want to do everything I can to not do that. I know that I have done that.
I think we all have. We've all had seasons in our life where we've done it.
Yes.
Yeah. And there may be more, but I think that when you know better, you need to do better.
Yeah.
And I think that it's okay to say to somebody, you know what? I don't know what it's like to be a white woman. I'm not a white woman. Yeah. Like, you don't know what it's like to be a Black woman. So, but we could talk about it, and we could come to each other with curiosity and say, look, let's talk about this. Let's be real with each other. What's this? What is this like? What's it like to
Yeah.
be that?
Absolutely. Yeah.
So
I think it's important. I have a group of girlfriends and we were all together, and I don't know if you remember, but like I feel like this is a safe space, so we'll just talk about it. But there was a time where I don't think it was Atlanta, but there was someone that a girl that had gone missing from the Black community, and she had kind of like, I don't know, faked her kidnapping, or do you remember that like happened a couple years ago? It was
Yes.
something like, you remember, Kat, right? And so
Vaguely, but yeah, I do remember it. Yeah.
one of my friends, my brown friend, was very much like, well, the reason it's a problem, right, is because when Black women go missing, people just ignore it. And so
Yeah.
now they're going to ignore it even more because of what
Yep.
it's kind of doing to
Yep.
the brains, right? And
Mhm.
stuff like that. And I was like, that's such a good point. I never thought of
With
it
the
that way.
bias.
But my
Yeah.
other friend was like, let's don't talk about race. And I was like, with our friend? No,
Yeah,
she
you need to.
learn. This is it's a place to be able, that's how would I
Your
have
friends,
ever
yeah.
thought that way, right? And
Yes.
yeah,
Yes.
like you have to find some people that you can like have those conversations with. And I think it's all about like what your intent is, and like, having people understand like that you want to understand like why it's different. And it's okay to acknowledge the differences. And if anything, my friends love their Blackness and like, I think that it's beautiful and love to talk about it. And
Mhm.
I love to hear about it. It's great, So I
Mhm.
think those things are really important because it is how people identify. It is part of who they are,
Exactly.
and I think we should do what we can I just think to like understand that and every way. And I think that the diversity, equity, inclusion conversation needs to continue. It needs to
Mhm.
continue to grow. Those programs need to exist,
Mhm.
wherever they are. And it's, again, like, it's not just about hiring, it's about how we can relate. So we can continue to
Exactly.
progress as a society. And I don't care where you go left or where you go right or anything like that. Ultimately, I don't think anybody can argue that if we understand each other better, right? Then we
We'll
have
have a better
the
world.
better cards, and we're going to have a better world.
Yeah.
So if we can just learn,
Much better world.
Yeah.
everybody just take a beat and just try to
Exactly.
think, maybe I'm not exactly right. And maybe it's worth listening to different voices from different mediums, right? From different news outlets, from my friend that's next to me that maybe I didn't want to talk about race before, but I want to understand better, and I do, right?
Mhm.
And so I think those conversations need to exist. And it's I will tell you, like, one thing that my Black friends tell me is, Kim, you can't tell a Black woman how to feel. Like, you can't do that. Like, you have to stay away from that. And I
Mhm.
think that's fine.
Yeah.
So what I want to do is create a space where they can tell me that, right?
Yes.
And they
Right.
can tell others that,
Yes.
because I do think it's really, really important. I
Yes.
really do,
Yes.
know?
I love when people approach me with sincere curiosity,
Yeah.
right? I would much rather you say to me, Michelle, like, I don't understand, like, maybe you saw something on TV or whatever, and it's like, what did that mean? Like, from your perspective, what did that mean? I'm cool with that. I think that's how we do exactly what you're talking about, that we create a world that's very welcoming and that we're not intimidated by one another, but it's like, hey, let's just talk about it. Let's rap about it and figure out,
Yeah,
like, where are we going from here? Like, what are we going to do?
absolutely.
So,
Yeah.
I think it's really important. And I think we have to remember to do that mutually. And so
Agreed.
no matter what it is that we're not understanding, I would rather just have the conversation as
Yeah.
opposed to people assuming or dancing around it, or it's the big old pink elephant in the room. And
Yeah.
people are like, yeah, no, there's not a pink elephant here. I'm like, there's a pink elephant in the
There's a
room.
pink elephant right over
Elephant in the room.
Yeah. I love it. Yeah.
Yeah. So I think it's good stuff. But yeah,
Yeah.
we've got a lot of work to do, girls.
Yeah, we do.
We do.
I feel like
And
on one hand too
Go ahead.
that
Yeah.
I
Go ahead.
if I'm around and my peer group, and we can have those discussions, but I
Yeah.
know, and it would be not even for me, because I respectfully say, like, I cannot
Yeah.
I cannot have your experience, but at the same time explain it to like external sources, it
Mhm.
exhausts me. And so
Yeah.
I that's where I'm at. Like, I get exhausted and just shut down. Like, I'm not engaging. I'm not in this conversation because
Yeah. Yeah.
it's
I think
exhausting.
I think that what I tell my white sister friends, as I call them,
Yeah.
is that it's like we more than ever need allyship, right?
Yeah,
In
of
terms
course.
of being able to call out stuff that is
Yeah.
like, well, that's not right, and it is exhausting. So think about this. I'm gonna just put this out there for you guys to think about. If you're exhausted, think
Mhm.
No,
about
totally. No, I completely respect and honor and understand that.
Your eyes are so funny right
Definitely
now,
do.
Michelle. You're like,
I get it. I get it. Here's
right. If
like,
you're exhausted, I just
yeah,
want to
right.
put it out
yeah,
there.
So what I'm speaking of is when I'm in these environments where it's a lot of people who look like me,
yeah,
Yeah.
and I speak up, and then it becomes this conversation, and there's
yeah.
those conversations that happen a lot that
Mhm.
become so. Okay,
It's
I'll say it
yeah.
this way, because my husband is African American, right? And
Okay.
I am
Okay.
so like just I sometimes I just like walk over them. My husband is definitely far more of a boss than I am at this. But
Mhm.
like say for instance, if I'm talking to maybe an older person in my family, I'm like microaggression after microaggression after
Mhm.
microaggression after
Mhm.
microaggression. And I just at a certain point, I just like this conversation's over. I gotta get off the phone. I gotta go.
Yeah. Yeah. I know you know what? I can appreciate that, Kat, because you sit in a very unique position
Yes.
too. You do. You sit in a very unique position. Do you have children together?
We don't.
You don't have children together.
No.
So my grandson is biracial. Okay. So the incident that I just described to you this past week, that was a big concern to his mom and his dad, is that how's he interpreting this world
Interpreting stuff.
around, right, around race, size, all of these things.
Yeah.
And so that's a whole nother can of worms, which we don't even have time to talk about.
Oh,
Yeah.
it's such a
We
long.
don't
We
even
can
have
have a
time.
whole
We'll come
bunch
on your
of
show and talk about it.
conversations.
Okay. Right. So we continue. There's going to be
A
parts
loaded
2, 3, and 4. I
conversation.
see.
Yeah.
Yeah. So I think that you sit in a very unique position and you understand um, both sides of it, which is why your voice you can't carry the world of it. I mean, that's not even realistic. But don't ever feel that your voice should be muted, because it shouldn't.
Yeah.
And I think that there's boundaries around it,
Sure.
and there's, do you know what I mean? Like if
Yeah.
Yeah, I used to the ways to handle it, I guess, right? Because you're
there's
right.
boundaries
Yeah.
around it, because there, and you may decide to, like, look, I'm just going to disengage, because if people don't want to change, they're not going to.
Yeah.
And you could talk until you're blue in the face and it's not going to happen.
Yeah.
But I think that you being able to be true to your values and being able to say, you know what, we can agree to disagree. And that's a thing. That's okay.
That's
It's like we can agree to disagree. I
yeah.
don't agree with you. You may not agree with me either. And that's okay. But I think that if we're going to preserve this relationship, then we probably need to set a boundary and say, I'm not going there with you.
Yeah.
And it's funny because one of the things, how we're all on social media and the bots come or
Oh,
whatever.
yeah.
I've had very few bots, and I think it's because one of my disclaimers when I say something controversial, and
Yeah.
I try to be really respectful,
Yeah. I do think
but
you're
I
very
but
yeah.
I'm very, very clear about, listen, my space, my pages on any of my social media platforms
Mhm.
are safe spaces.
Yeah.
And so just know that
Mm-hmm.
if you come for me,
Yeah.
you're going to be blocked and you're going to be blessed. And
Mhm.
so I'm not going to have that in my space, because that's not who I
Yeah.
am.
I'm like that
And
too.
I'm like, my
100%.
followers, that's not who they are. So
Yeah.
if
Yeah.
you can share maybe your, as you said, Kim, like, it's cool if there's something that I'm saying and you have another
Yeah.
opinion, and you can be kind about it. But I
Mhm.
promise you, Michelle Tedder, Coach Tedder, Nurse Tedder, whatever the hell you want to call me, I will not tolerate the
Yeah.
foolishness, because I'm
Mhm.
like, that's not
It's yeah.
respective of who I am.
That's that fine. That's where you draw the
Well, it's
line.
just like you said, if somebody comes to you with genuine curiosity, you want
Absolutely.
to understand, then I'm okay with that too. You know what I mean? Like, and even sometimes, like in my lives with TikTok, when I'll have people come in and be like, "Oh, you're all gonna die and explode and turn into
Because
heads and all
explode.
these things," and you know what I mean? Like, they come in and say all the things, and this one person came in, I was like, I just very calmly, like, a lot of this is how you take it, right? Like, and I was like, "Tell me why you say that, and tell me, like, and what it ended up being was that person had pancreatitis or gastroparesis or something like that from the medicine. And so, well, at least what they said, people make things up,
Right.
but that's what they said, right?
Mhm.
And they also confuse things as things that they are, but that
Mhm.
happens all the time. But I was like, look, I'm sad that you didn't work for you, but it's
Mhm.
working for millions of people. And if you want to stay here and you want to learn and you want to be a part of the conversation, okay, but you can't just scare people. You can't be cruel and you can't say all these things. And then I said to her, I was like, think about it this way. Let's just say there's someone that smokes, right? And they smoke cigarettes. And I was just very calmly, just being as calm. A lot of this is how you deliver it, right?
Yes.
And I was like, if you smoke and then you get cancer, do you think that once I got cancer, that because I smoked and it was a decision that I made or choice that I made or whatever, whether it's that I had issues with addiction or whatever it is, do you think that I shouldn't get cancer treatment to save my
I
life?
love
Yeah.
that.
And
I
everybody
love
was like,
that.
and because it's a different way to think of it, right?
Yeah.
And we eventually I was like, she kept it up and I was like, I have to block and bless you. I'm sorry. I hope you I'm sorry. I've given you as much space and grace as I can, okay? But like that happens all the time. And like it's like a year ago,
Mhm.
the lives got really crazy big on TikTok. It was like 500 people, and the trolls were so bad, and I was becoming mean because
Mhm.
like I think that energy just feeds
It it
off of
That
yeah.
happens. Yeah.
and I was
Mhm.
like,
You
and I
become
quit
mean
for
as
a
well.
long time. I quit for a
Mhm.
long time on TikTok lives, many months,
Mhm.
because I don't want to be that person. That's not who I
Mhm.
am. And
Mhm.
it was bringing all of that out in me. And I was just like, yuck.
Yeah.
So, but the thing is with this podcast, and I've talked with Kat about it because she does sit in this unique place.
Mhm.
We can't not talk about the fact
No.
this
Yeah.
disparity exists because of what we're talking about. But it's about bringing people on that do have the lived experience that can,
Yeah.
and so I'm so blessed and thankful that you're here to have this discussion
Mm.
with us so that we can try to think about things a little different,
A
right?
little bit
Handle things a little
differently.
kinder,
Yeah.
with a little more empathy, consider different points of view. Because I don't like this world of right, left, red, blue, right, wrong, this, that. Like, let's just
It's awful.
about it. We can still believe how we believe, but just open your ear and your mind just a little. Open your heart and everything just a little. Just
Just a
give it
little.
an opportunity to take that space, like, and have these discussions around size, around
Mhm.
race, around gender, like of all
Mhm.
these different things that we don't understand.
That's right.
Get to a place where you can at least hear, and because like rarely is someone going to say something one time, you're going to go, oh, that changed my point of view. But if someone
Mhm.
hears that 5 to 10 times, maybe they'll be different. Today's episode is brought to you by the Row Body Program. If you've been following along on my GLP-1 journey, you know that managing weight and metabolic health is a huge part of what I advocate for. Row's approach combines GLP-1 medications and then personalized support, giving you a tailored solution to help you take control of your health. And it's more than just weight loss. It's about finding the balance and the support that you need for long-term sustainable change. If you're ready to take the step, you can go over to row.co/plus sides with a Z and see how Row can support your journey. That's row.co/plus sides. I'll link it here in the show notes. You're not alone. It's not your fault.
That's right.
Like that's what evolution is about, So anyway,
Exactly.
it's an uncomfortable place to be in, to have these conversations about these things, especially because I want this podcast to represent everyone, not
Mhm.
someone that has one political view over another.
Mhm.
I think
Mhm.
anybody that knows my content knows that I'm squarely down the middle, right?
Yeah.
But I do vote though, right? So I
Mhm.
pick sides, So,
Mhm.
but I think
Mhm.
that what it isn't, but what I do is I consider, right? And I
Mhm.
try to listen. And if anything, I'm listening more than I ever have before.
Yes.
And I just think that that's important. And I thought it was good to talk about it today.
Mhm.
Kat had a
Well,
really
speaking
and
of, I mean, yeah, I was going to say, the questions, right?
more questions.
So
Yes.
we get a lot of guests that comment on disparities in healthcare. We're
Mhm.
talking about that right here.
Mhm.
Would you consider elaborating on these challenges, especially your perspective as a person of color and how they interact or intersect with obesity care as well?
Yeah. I mean,
Big
I think I'll start with a lot a lot of the probably most of the most impactful
Mhm.
weight bias that I experienced was from healthcare providers, which is like
Yeah.
kind of crazy, but I'm like, well, I'm a healthcare provider, so I don't know.
Yeah.
But that didn't
But
matter.
even you have bias towards yourself.
Right.
We
That's
talked about that
exactly
in the
right.
beginning of your story.
That's exactly right.
But
I
did
had
they
developed my own internal bias too.
did your education somewhat get biased? My sister's a DNP, so she's
Okay.
told me, she said, yeah, they do teach you some bias while
Yeah.
you're
Yeah.
taking
Yeah.
your course.
I don't remember. Like, I went to school in the 80s. I'm
Mhm.
old, guys.
Mm.
I'm really old. And so like DEI wasn't a thing.
Mm-mm.
It
It's
wasn't a
new.
thing.
It's
It's
very
very new.
Yeah, it is.
It's way too young to get away with. To do away with. I'm sorry, no.
No, exactly. So I don't recall that being like a class or
Oh,
whatever.
no, not a class, but like, yeah, my sister just always, she's like, you can feel the bias, the weight bias from.
Correct. That's
Yeah.
right. And so, and I mean, part of the problem is in nursing school, and your sister probably would tell you this. I don't remember a class. We didn't have a class on obesity. It's not
That's
that
what
I
the
remember it.
doctors
We
say
did not.
too.
That's
The
new.
doctors
Yeah.
say the
That's new.
same thing.
Right. We did
Yes.
not. I did
Mhm.
not. I had a class on nutrition that sucked. I mean,
Yeah.
it was not good. But no, we didn't have a class on obesity. So this is a very new, nuanced piece. And I think it has to do with these spaces that we all have created saying, hey, you've got to talk about it. I had a knee injury 15 years ago. And I had torn my meniscus, but didn't know that's what it was. The thing I kept complaining about was I couldn't dance anymore. Like, I'm like,
Yeah.
I don't know what's going on, but I can't dance and I have this pain. And I
Yeah.
remember I ended up going to probably 3 to 4 orthopedic surgeons over a period of 6 months before one finally said, and all of them prior to the one that had some sense, said, oh, you just need to lose some weight.
Of course.
You just need to lose some weight. That's why your knee's hurting. One told me, we'll lose 50 pounds and come back and see me in a month. And, we'll talk about what we can do with your knee.
Yeah.
And I remember walking out of that office feeling so defeated and annihilated.
Yeah.
And it wasn't until
50
I said,
pounds?
girl,
Like
50 pounds
50
in a month.
pounds? It's hard to lose one.
Girl, in a month. Girl.
Seriously.
That's my story. So I'm like, I mean, that's my story. I'm like, oh, 50 pounds, you got the magic, the holy grail. Let me know what that is. Right. So anyway, fast forward, I end up talking to one of my other physicians and said, like, this knee is bothering me. What can I do? And he's like, here's a couple of colleagues, go see, pick one. I get to his colleague and he gets the MRI and he's like, this is ridiculous. This should have been fixed 6 months ago.
Yeah.
And so, and that had lasting impact on my knee functioning. And I just had a knee replacement 3 months ago. And I'm happy to say I'm finally turning the corner and all will be well. But
are you dancing again?
Yes, I can dance. I've been trying. I've been practicing a little bit in my house. I'm like, oh, the knee moves.
There it is. There it is. I love it.
I'm back to the Cupid shuffle, y'all. Like,
yes. That's the important part.
Okay. All right. So anyway, but I'm sharing that story because we're talking about how these things impact. I think that those physicians just automatically were bought into.
Yeah.
And not just one, it was like 3 who were just bought into 10 toes down. You just need to lose weight. And I'm like, I could do everything before I hurt my knee. Like, I'm telling you.
I get that. Like, and I will tell you too, like, and maybe this goes back to, again, like considering more information and being ignorant in different perspectives. Again, ignorant is not informed, right? And like, if you think about it, if the same curriculum is coming at these doctors, right, at every school, right, because that's a standard, right? Then if the standard is, hey, they need to eat less and move more because we know obesity is bad. Get them to lose weight. That's how it's going to solve the obesity. That's how it's going to solve the heart disease. It's how it's going to solve just tell them, stop it. Tell them to eat less, move more, get them on a diet. If that's the conversation, then of course, right? That gets back into the bias that we talk about. It builds it. And a lot of that comes from not having like proper education around it, like not having proper systems around it. These
Thank you.
things do matter. They
That's
do,
right.
you
That's
know?
right. Well, and I will say I'm happy to report that for the last 2 years,
Mhm.
I have been fortunate to be faculty for one of the CME trainers for doctors, and I have been able to present from the lived experience. And they are talking about it's a group of endocrinology fellows,
Oh,
and yeah, and so and one of the things that I've been a heavy part of advocacy around is saying, like, listen, you have to train healthcare professionals
yeah.
from the early training, nursing schools, CNA schools, medical schools, whatever it is. If you're going to be
Mhm.
working in healthcare, you've got to include this in curriculum. And so I think in 2023 there was the White House Conference on Hunger, Health, and Nutrition. And I was fortunate to be invited to attend. And so we had these think tanks, and that was one of the priorities in the previous administration,
Yeah.
is that we make sure that healthcare professionals are well trained in the
Nice.
area of obesity. So
Yes.
we're making strides. I mean, thank God, but there's still a lot of work to do because
There's
there's
so
still there's
much.
still
Do you know how I know that there's a lot of work to do? My lives.
Yep,
If you're just my
Yeah.
lives,
yep,
everybody's
Oh
lives.
yeah,
If you go
100%.
on a TikTok live,
yep.
people are
What's
being
going on
misguided.
social period?
They
Yeah.
are lost. They
Yep.
are going to their PCPs who either won't write the script,
Well,
won't, and they won't tell them why. They'll give them some bullshit excuse like you're not diabetic.
Yes.
No, this is approved, right? And
yeah,
things like that. Or it's because they don't have the staff, or because they want to remain ignorant because they don't want to learn new things,
that
right?
part.
And then they won't, right? And then they won't do better. But the problem is that's the first line of defense is
It
our
is.
PCPs. We need help. There aren't enough obesity specialists. There aren't enough
There's not.
endocrinologists. So we've
There's
got to get these PCPs, these general care providers, like primary care providers, we need them to be at a place where they at least understand how to prescribe and manage side effects, and or like they're able to refer out. Like I think that there's something to be said for if you're a PCP. I'm just saying if you're watching this, we have doctors that watch. If
Yep.
you are, right, consider if you don't know and if you don't want to get involved, which you should go get involved.
Get
But if
involved.
you really don't, like if you don't have the staff, find a telehealth, right? That specializes in this, like
Yep. Yep.
Accomplish Health or something like that,
Yep.
that you
Mhm.
can at least refer them to. If you can't care for your patient, it should never be I just don't believe this, that you
Mhm.
should ever just be like, nope, wash my hands of it, unless you're willing to refer them to a specialist of some kind
I
to help
agree.
them. It should not just be like, nah. They need
Mm,
to have a medical reason of why they won't treat you or won't help you. But again, if it's staff, if it's I can't, if I just don't have the knowledge, good
mhm.
news. That's why we have
That's
specialists.
fair.
Mhm.
That's why we
Yeah.
have special. That's
Yeah.
fair. Exactly. I one of the episodes I'm planning for my new season is my PCP. She just recently retired, and she's the person that I make reference to anytime I do these, because she literally walked me through. She was the person who really helped me to change my own mindset, and was a champion for helping people to get
Awesome.
connected to the right care. So
Yeah.
I really want I want to have that conversation with her, because I think it can be helpful to
Yeah.
hear her as a former PCP,
Yeah.
who, like, how did you help to navigate this and elevate this issue with your clients? Because I mean, she's so dear to me. I don't even
Mhm.
think she knows how dear she is, but
Aw.
she really she was the game changer. She
Yeah.
was the game changer, and I think that's the other
Sure.
thing that healthcare providers need to hear, is
Yeah.
that you really need to, other than telling people to exercise more and eat less, you need to
Yeah.
approach people with compassion and curiosity,
Yeah.
because nine times out of 10,
God, that was so
people
good.
have
Say it again.
already,
I
yes,
just love that.
people have already done it. They've already done that. They could tell you how to do it. They could
Yeah.
tell you how you, healthcare professional,
Yes.
they could tell you how to eat less and exercise more. Most of us who have gone down this road and are begging for something different, we've
Mhm.
already done that.
Yes. We've already done that a billion times over. you
a
know?
billion times over,
Legitimately, like, I'm
so
telling you, I've been trying to control the size of my body since I was a little girl. Like,
Yeah.
and
me
my
too.
parents don't remember me struggling with being picked on or stuff like that. I was in pre-K and I remember being bigger and different and everybody knowing that I was bigger and different, right? And,
Aw.
yeah, I mean, like, I've always been, you know,
Mhm,
Yeah.
taller and bigger and, like, genetically, like, and,
mhm.
I have, and
Yeah,
it makes
yeah.
sense. My father's taller and bigger, my mom's average, I'm kinda smack in the middle, like, and I
Mhm.
think it's that's the thing is, like, we've even had, doctors on our show before that have talked about how, like, we had one doctor that is a pediatrician that has 2 children. One, more of the genetic lottery in terms of body size, and the other one, not so
Mhm.
much, and it's hard for her because
Mhm.
she's like, "They eat the same things. They eat the same
Yeah.
things," And it's true, like,
Yes.
I think there's so many pieces to obesity, and it is so complex, and but
Mhm.
people automatically assume, right? They're not challenged
Yep.
that bias, right? They're automatically assume that when someone is large, they are gluttonous, they are lazy.
Yes. Yes.
They assume,
Yes.
right? I've heard Dr. Phil assume it. Like, it pisses me off. Like, you know what I'm saying? And I just but like it
Don't
just
get me
I hear
started,
it. I
Kim.
know, that's for your show. But
Oh,
I
Dr.
I hear I
Phil.
hear it. Like, I hear doctors, but I mean, like, I think there's people like Jillian Michaels, right? I mean, if you hear some of her
Oh,
stuff, like, she
biggest
shames like
shamer.
nothing I ever heard, right? Like, my
Mhm.
husband's like, "I actually think we should have her on the show." And I'm like, "We will not have her on the show." And he's like, and then he challenges me. He's like, "Remember that bias thing? Like, you remember, like, we should listen to opposing views." I
But
was like,
no,
"He didn't
I'm with
shame
you,
Nah,
Kim. I'm
you
with
no."
you, Kim.
I'm like,
nah.
"If he didn't shame us, it'd be different." Like, you know what I'm saying? Like, that's where people lose me when they start calling each other
Mhm.
names and things like that. Then I'm like, "I can't hear you anymore. I wanna hear you. Let's
Yep,
don't call each other names. Let's just talk about it?" And I
that's
think that
right.
that's really important.
And the other
But,
thing too, I forget what percentage of the people who were on, like, Biggest Loser gained all
yeah,
that weight back within, like,
I like
12
on
Oh,
the surface
but
one.
yeah, I mean, well,
Yeah.
you're in a very controlled environment, right? You're working out
Mhm.
like 6 hours a day.
Yeah.
They're
Mhm.
controlling your caloric intake. Everything is monitored.
Yeah.
Of
Yep.
course, you're going to lose. And then,
Yes.
but I felt it was kind of really unfair. It's when I was like, this is borderline kind of abuse to these people's bodies where when
It
they
is.
send them home for a couple of months and then
Mhm.
make them all run a marathon.
Mhm.
Mm, Not
Yeah.
everybody's fitness levels. That's a very
It's a lot.
difficult,
I
rigorous
The
thing to
whole
do.
Listen,
idea of
I
that show, and that show is a
Every
cult
contestant
following.
run a
Why was it so
marathon.
popular? Like, why I always wanted to ask that question. Why do you think it was so popular?
Oh, not
I
even
feel
that,
like
but you know, Extreme Makeover, weight
yeah,
loss edition, that
I
was
was
Uh-huh.
awful. That
like,
was awful. There was a one it was, they were the trainer, that husband-wife team, but I would
Chris Powell,
yeah,
and I forget what his wife's saying. Now
yeah.
see, the thing I did like about that show, they
I
did
didn't
at
watch
least follow people for a year.
that's
They
fair.
did, but they had
They
this one
did.
they had a woman who had, like, an eating
So what would
disorder
they do? They would, like, go
on
on a
it.
diet or, like, what would
They
happen? Like,
they
what
would
was the
come to your house, they would do more of, like,
Yeah, they
some of
were at
the
the yeah.
behavioral intervention. You went
Mhm.
to Colorado and, it was like boot camp.
Yeah.
But they continued to follow you and they help, like, they pay for, like, some of the skin removal surgery. So I
True.
felt like
Yep.
it was a more humane, um, kind of
It
a
was a little bit of
show.
a more humane approach. I guess what
Yeah.
lost me was the woman who was struggling with an eating disorder with,
Mhm.
I think bulimia or binge eating. I don't know what it was,
Mhm.
but they put these stringent, like, requirements for her to lose, like, 40 pounds in several months. I'm like, "She
Oh,
already
yeah.
has an
She already
eating
had
disorder."
exactly.
I think a lot
Yeah,
of people don't understand that these diets that they put people on with obesity just tend to exacerbate our
absolutely.
eating disorders, right? Like, for sure, Weight Watchers did that for me, and I know many others,
Me
like being
too,
able to eat
Kim.
free foods, like, you'd be able to eat,
Me
like, corn
too.
and shrimp, girl, let's do it,
Yeah.
you know?
Her shrimp
Like,
is good.
oh, and I'll be so proud of myself. I had no points today. What's tomorrow? A donut? You know what
No.
I'm saying? Like, it's not, but I know that the goal of it, and like I talk about my first diet was when I was 8, right? And it was Weight Watchers. And I remember, and I talk about the rice cake story a lot, but like it's in my keynote. But when I drizzle the rice, I was drizzling the chocolate sauce over the rice cake. This is in the 80s, right? And eating that. So my mom and I would have something that tasted good to our brain so that we could go to sleep. Now we know more because my mom's on Ozempic too. My dad's on Ozempic. My sister's on zepbound. Like I'm on tirzepatide. You know what I mean? Like it's like we're all on it. Like something's going on. You know what I'm saying? Like it's just like,
Right.
my other sister not, but everybody, all the rest of us are, and like I remember that like in my life. And it was such a like defining moment for me, like always trying to use food to control the size of my body and then always feeling like a failure. Like that's something that resonated with me in your story. And I know will many others is when you were like, I'm this health advocate, but I'm not like, so what you're right. I'm not healthy because I have obesity.
Yeah. I totally get that. Yeah. Being into like fitness all my whole life. Yeah. Being sporty. Yeah.
Absolutely. Or here I am with a health and wellness podcast, but I still live in a big body. I still eat meatball sandwiches, and I'm gonna. You know what I'm saying? Like, you know what I'm saying? Like, and so sometimes I feel like a little bit of a poser, but at the same time, I'm like, but I'm not here telling you to be like what those people have said. Like, I'm saying, accept yourself and love yourself, and you're worthy of care, right?
Exactly.
Like, it's a disease, right?
And you're worthy of comprehensive care.
Yeah,
It's not, and I always say living with obesity, it's not either and, or rather, it's not either or, it's and. That's what it is, right? And so we don't know what parts of the toolbox are going to work most effectively because we're all individuals, right? Back to why we need to be able to look at and study different people. But anyway, I'm gonna come back.
I like how you stitch that together.
I'm gonna come on back
in this episode for us.
Right. Like with your practitioners, I'm just gonna pop into this question too that I've been like chomping at the bit to ask, right? Like, so how do we shift the conversations from weight management programs, right, to recognizing obesity as a complex chronic disease that requires comprehensive care?
So I think we can,
and insurance plans.
Yes, I think we continue to come after diet culture because I think that's what got us here in the first place, right? Is that, okay, those are facts, is that if you look this way, if you eat this food, if you do this exercise, voila, you're going to be this picture perfect, whatever that is, okay? Of what
that is,
the images, right? Whatever that is, and whatever that is in the moment, because it's always changing, right?
Yes.
So I think that we continue to come for that and be able to say, yeah, no, media, that's not cool. Like, don't depict health in that way. And I think that changing the conversation from like losing weight to, look, how do we help people become the healthiest that they can be based on their individual body composition, whatever their underlying conditions are? It has to be highly individual and not this one size fits all, which we've been fed most of our lives. Is it? Because I remember asking my mom when I was probably 15 or 16 that if I could go to this weight loss center. It was called, in my neighborhood, it was called Spa Lady. I don't know if it was a national chain at the time, but like I said, I'm old, so forgive me. But I remember being a teenager and wanting to be able to go to this program because I didn't look like the other girls, or I was bigger than the other girls. And so I think that it starts with shifting from diet mentality and diet culture to calling out that obesity is a disease, which I think we're making some headways with that, because there's still people who still want to argue and say, well,
even in the medical community,
like
it's society for sure. Like, but even in the
medical community. So I think we continue to push back and say, no, actually, we have the data now. We've got the research. And if that were true, we would have solved this by now. So stop it.
And like legitimately in the height of diet culture, obesity was just going up.
Up, right?
Up. So clearly
that's not it. Okay. So I think that really, like, taking a hard line about that and not being ashamed. I don't know how you guys feel about this, but I feel like there's there's a shame element in saying that obesity is a disease for some people. And I'm like, why is that shameful? Like if you have type 2, which many of us do have an underlying, because I do, it's just managed at this point,
Yep.
So anyway, so we don't say to people, we don't say morbid diabetes, we don't say morbid heart disease, right? So even that is a signal, if you will, that this is something different. And it's like, I'm like, it's a disease. And so you wouldn't be encouraging people to come off of their meds if they're taking them for high blood pressure, or if they're taking them for, I don't know, kidney disease. You wouldn't be like, so when are you going to get off of that? When are you going to, I mean, you wouldn't, you just wouldn't do it.
True. I mean, my dad has chronic leukemia. He'll be on chemotherapy the rest of his life. You know what I mean? If he stops taking it because it's chronic, it's at that stage, right? It'll come back and it'll kill him.
That's right.
Like it's the same idea, right? I'm not saying it's so we think about that's I tell you, listen, I think a lot of it has to do with the fact that we have been calling these weight loss medication.
Yes.
Every opportunity we
get.
Every
opportunity.
Right. And not even like anti-obesity medicine. I think that'll take forever to grab hold because it's clinical. But I think that every time, because that is what people understand.
Yes.
Right. You know what I'm saying?
Yes.
And like I know we had that Super Bowl ad that just came out. And
which
like
I have to go watch. I haven't seen it yet.
Oh my gosh.
I
Should I
know.
share it? Should we watch it together? I have to know what you think.
Yeah.
All right, we're gonna watch it
again.
Yet.
You want this is like this our closing, not closing, but like this would be a good provocative question.
Guys, we have to do this again. You realize we got to have part 2. We got to have part 2.
Yeah. Oh, yeah. Well, let me ask this question then, and then we're going to get to hims and hers. Okay. So this misconception of body positivity and using GLP-1 medications they don't go hand in hand. Like we have turned our backs on body positivity, right? Can you speak to why body positivity and medical treatment for obesity, like a GLP-1 medication, don't have to be mutually exclusive? How can people embrace both self-love and commitment to their health?
Yeah, I've talked about this on other panels, and here's Coach Tedder's take on it.
All right, Coach Tedder.
I think that in order to successfully live with the disease of obesity, we got to start with being positive about how we see ourselves. That has been part of the problem that it's gotten us to where we are today, is that the shame, the blame, all of that stuff is that, well, if I lose 100 pounds, then I'll feel better about myself. No, look yourself in the mirror and say, girl, you bad at whatever size you are. It's like, but I want to be healthier, and whatever that is for me, right? Whatever that is for me. Maybe it's I need to start with doing more mindfulness. Maybe that means that I should dress like a diva at whatever size, whether I'm a size 24 or I'm a size 14. Like I'm a dress like a diva. Whatever the case may be, they're not mutually exclusive. I'm like, body positivity. I'm like, everybody's like, this is a movement or whatever. I'm like, girl, body positivity is about loving yourself. That's all it is. And so we should not put this on, well, if you're body positive, then you don't need to worry about losing weight. Well, if my metabolic health is at risk, actually I do. I do need to, and I do need to get it treated. But that does not mean that I neglect the other piece of self-love and self-care and seeing myself as a beautiful human regardless, because the scale doesn't define me. It never should. But again, back to, I'm still come for diet culture. That has been the holy grail of whether or not you are worthy of anything. And it's like, that's the bullshit that we've got to like dispel.
Yes.
That's it.
And it runs so deep.
It's so deep.
It's not only deep in our culture, but it is deep in our brains. Like this, when this stuff happens to you, especially as a child, right? So if you've dealt with childhood abuse, like Kat and I have, then that stuff is so deep. And here's the thing, I still have those thoughts, but
Mhm.
because I've learned more,
Yes.
I considered
Yeah.
other perspectives, and I've asked people to know more than me about certain things, like the doctors and stuff that come on the show. And I've learned more, then I can go, and I can like take that thought and go, but, and then, and just do differently and treat myself better. And I think
Mhm.
like the idea of worthiness is such a big
Mhm.
piece of this
It's a
journey. Like
big
what
one.
you don't, right, is you need to understand that you are worthy of care. Like,
Yes, you
and
are.
Pat and I, we still live in large bodies. And with the where science is
Me
right now,
too.
unless we were to like get surgery, and even then, like there is no there, like, and I remember really struggling with my identity when I thought that I was going to get below plus size, when I started worrying about it.
Mhm.
And I was like, but I
It's been
identify,
such a big part of you.
I
It is such
identify
a
as
big
a
part of
big,
you.
beautiful woman. Like that is, I
It's such a big
accepted
part
that
of you.
piece of myself. And I think that the reason that people get upset about these medicines, and I saw a beautiful video from a girl on TikTok that did, I don't know if she was like a big influencer or not, but her video was gorgeous. I duetted it and everything.
Mhm.
And, but she was like, it does challenge morality for us in general, right? If
Mhm.
somebody is all of a
Mhm.
sudden thin and they did it with this medicine, then we're not sure if they're moral or good, right, anymore. And it does. And it also challenges everything in our society,
It
right? Because
does.
it challenges the clothing that we wear. It challenges the
Absolutely.
food that we eat. It challenges every industry, $1 billion, multi-billion-dollar industries. Like it's challenging everything. And that's why it's such a big conversation. And so like
Mhm.
when this commercial came up, and I know it's very controversial, right?
Mhm.
And there are many things that you can do to pick it apart if you know what we know, right? But
Mhm.
think about, this is going to most people we don't know. I've been trying to film a documentary for over a year now.
Mhm.
And I interview people on the show and all these different things, and I'm collecting all the stuff. And it costs a lot of money. I need someone to help me make it. Am I listening? Okay. But it's about this movement and what's happened on TikTok with this movement, like, and the times we've been censored and the times we've been squashed and the times we've been, all these different things, and how we kept coming back because that's what
Mhm.
Yeah.
That's what we
and
do.
I think that that's what's really interesting about people who struggle with chronic diseases in general, but particularly with obesity, because you continue to make these changes that people
Yep.
tell you to change. You lose the weight, it comes back and then some. You use the weight and then it comes back and then some. There's got to be something here. And it can't just be that, you're fat and lazy. That's just,
No.
it's a little too easy. You know what I'm saying?
Exactly.
It's a little too easy at this point with this much data,
Exactly.
But
Exactly.
this commercial, I want to play it. I'm going to play it on here for us. And I hopefully won't get a strike, but we're gonna do it. I'm gonna because I'm really curious to how you feel about it. Like,
Yeah, I haven't seen it yet. Everybody's been telling me like, "What? You haven't seen it?" I'm like,
let me
I
go.
haven't seen it yet.
Okay, we're gonna do it. We're gonna do it. Here it is.
Okay.
All right, I'm gonna start. Can you guys see it?
Mhm.
Yeah.
All right, I'm gonna make it big and play. Can you hear me? Okay. Let me know if you can't hear it.
Mhm.
Future of healthcare. An escalating controversy this morning.
Oh man!
This Super Bowl ad.
All right, that's not the right one. Well, I think they may have taken it down.
Really?
Can you imagine? It's got to be somewhere. That's ABC News. That's YouTube. Super Bowl commercial
Go
propaganda.
to
it's-
Dave's account. You'll probably get it. Uh-oh. Everyone's frozen. Am I frozen?
You're not frozen. Am I frozen?
I see you, but Kim is frozen now.
Oh yeah, Kim is frozen.
Not
Oh,
anymore.
there you are. There you are. You're back.
All right, let me try to go to Dave's account because you're right. I do think he posted it. All right, so
Okay.
on the pen, hymns and hers.
Yeah, I got you into it. When
Yes.
Dave does his
Interesting. I put in on the pen, hymns and hers, and it doesn't come up either. Man, you can't even
Let's look
find
at
the
it.
ad. All it is people commenting on the ad. They want it
Really?
down.
I wonder if they took it down because yeah, there was a lot of controversy about it. I've been hearing about it. I'm like, okay, I'm gonna watch it. I gotta watch it. And you know what? Let me see something because I was on a
I'm gonna
call
look at Dave now.
yesterday and somebody told me,
We gotta watch
and
it.
actually I thought that oh, you know what, guys? It's gone from there too. I wonder if they took it down.
Yeah,
Oh, wow.
I think Dave has it. Let's see if this is. I think this is it.
Okay.
You hear it?
No.
I can't hear it.
Hold on. Let me share screen. I found it. All right.
Oh, did you? Okay.
Dave's. I got Dave's because he did it in
Okay.
green screen.
Oh.
All right, here we go. We're going to look at Dave's. We love Dave.
Obesity leads to 500,000 deaths each year. Why? Stop eating, Jimmy.
This is America.
Something's broken, and it's not our bodies. It's the system. Welcome to Weight Loss in America.
Like and subscribe.
A $160 billion industry that feeds on our failure.
Yeah.
There are medications that work, but they're priced for profits, not patients.
This is America.
This system wasn't built to help us. It was built to keep us sick and stuck. But not anymore. Hims and Hers offers life-changing weight loss medications. They're affordable, doctor-trusted, and formulated in the USA. You get a treatment plan designed by a doctor to fit your body, goals, and lifestyle. You deserve to feel great in your body. This is the future of healthcare. This is Hims and Hers. Join us.
That's it. So like there was a little bit more in the beginning, but what do you think?
Interesting.
Right.
Very interesting.
Yeah. Like, and what I don't like is that, and Dave made a good point about it, is he was like, the fact that they say something's broken and it's not our bodies. No, our bodies are broken.
Our bodies are broken.
That's legitimately, that's why these medicines work like they do, because they're treating our disease and our bodies are broken. They're broken for many different reasons, right? But ultimately, you know what I mean? But I was talking with Dave because I'm in marketing. That's what I do, right? And I was talking with him and I was like, you know, we were on the show last night when we were talking about it. And I was like, I think that it's because like when we were filming this documentary, back to that, it's like when we were trying to talk to people and interview them, like, what do you think about, you know, GLP-1s and the obesity revolution, all the different things, right? And nobody knew what we were talking about. But when we said, what do you think about Ozempic for weight loss? They knew. And it's just because the ignorance is very thick.
It is very thick.
All they know is Ozempic for weight loss, celebrities, and fat people taking it from diabetics to lose weight. They don't understand they don't think about it like a disease of obesity. Like that's not the people that we interviewed. And I'm sure that if we continue to interview more, you know, it would be different. But it wasn't until we changed our messaging and our questioning that they were like, oh, is that what you're talking about? You know?
Yeah.
We asked people in small bodies. We asked people in big bodies. We asked men. We asked women. We asked young people. We asked older people, you know, and I think that's the whole goal, right? Is they were going for this massive audience, right?
I think so.
You know, I think that, and I think that like there was a lot of controversy, right? Again, like on if they should talk about like, because anytime you ever advertise like Ozempic, you have to talk about all the side effects and stuff, or like it's part of the.
You have to. Hang on.
But they were talking about compounds, so they were saying we don't have to. Right. So I think that was a piece of the controversy is they wanted them to say all the things and not make it look like it was the best thing ever. Although I think many of us can agree that medicine is the best thing ever. Right. But I think that's what sort of a lot of the rub was that I was hearing about it. Did you hear anything different, Kat?
No, that was the one that the takeaway. I first saw it on Dave's account. And then we watched it when I was watching it at a friend's house for Super Bowl. Nobody was paying attention to it.
Nobody was paying attention to it.
They're like, where's the beer?
Yeah.
You know, we're going to go refill on the brisket. You know, there was no one. Yeah.
So can I tell you guys, I don't know if I'm like, I sit in a lot of rooms, right?
Yeah.
And I'm sure you guys do too. I know, Kim, you get out there
Mm-hmm.
a lot. Both of you do. I think I understand, but they needed to take an and approach, right? So the piece about the system is set up to harm you. I know what they're getting at.
Same.
True.
Do you see what I'm saying? Like, I'm like, what they needed to do, and I'm not a marketing person.
Yeah.
They needed to be inclusive of, you have a metabolic disorder. The system has not seen you or heard you.
Yeah.
Because I think that's what they were trying to get at.
Yeah.
Because that's very true. Because as we all talk about weight bias and how we've all been impacted by our healthcare providers and systems, and I've got a bunch of other stories. We just don't have time for them.
Yeah.
But I have a whole bunch of others. Part two, right? About how that has played out, even in my journey after weight loss surgery, my journey to have like reconstructive surgeries because of skin, all of those things.
Yeah.
And so I heard, I'm like, oh, you were trying to give voice to the systemic
Yeah.
infrastructure that has been set up to harm us. They're not lying
Yes.
about that.
No.
True.
Okay.
Yeah.
What they failed to do was capture, you're not crazy. You have been living with a metabolic disorder that has not been affirmed, acknowledged for many, many years, and has drawn you into this place of not like thinking it's your fault, thinking that you don't have options.
Yeah.
And now you have options. And
For
so
sure.
that's the missing piece. So that would be the feedback I would give to whoever designed that ad is that, wait, this part is not correct.
Yeah.
And you need to message that in a way that affirms those of us living with this disease.
Yeah, absolutely. And I think that ultimately what they were trying to do is, cast a wide net, right?
Yes, I think
And
you're right.
be able to have that piece of the conversation be the next level once people come in and want to sign up for Hims Hers, right? And I think that's what it was, is how do we, it's just like on TikTok when we make hooks, right? How do we entice them? And I will tell you what it was like for me watching that commercial as somebody who was one of the first 100 or so creators in this community. I would say in 2022. To see us go from the dark side of TikTok, where like literally everybody was following us, but nobody wanted to admit they were following us. Like this side of TikTok, like they were on weight talk or or GLP talk or whatever, right? Or Mounjaro learning talk or whatever. Nobody wanted to admit it. To being on the Super Bowl, like, you know what I'm saying? Like we went from in 2.5 years. We went from the dark side of
right with the notion of that system being broken. Yes, because that was still a piece.
Yes.
And so I was like,
wow.
holy shit. Like, and sometimes you do have to drop a big, I hate to say it, but like bomb to be able to have that conversation ripple out. And I've been talking about like this being a movement, right? And being like a way that this has been going on for a while, like since the beginning. And I was saying on the show, I feel like now it's like a wave because it's all of our voices, all of our podcasts, all of our Obesity Coalition type of groups, right? All of us together. It's like a tsunami. Like that's what 2025 can be. We have come really, really far. Obesity in 2.5 years. You know what I'm saying? Like it's, and this is, arguably, like we had, I don't know if you know Dr. Catherine Tumor. So she's been on our show several times. And she said, she's like, it's the last bias we actually allow. Like that we go, it's okay.
It's the last prejudice that we can.
It's the last prejudice that we allow to exist in our society is those with weight, and the fact that we moved that needle in 2.5 years, as far as we did, to where not just talking about the medicines and the,
but you're taking the medicines from the diabetics from that to
going from you're taking it from the diabetics, right? And to fat equals lazy, right? To having, and then also compound all the disparity around that, because I had an episode about that in the beginning. I was tired of the fact that the shortage was so bad, that people were losing access, that the coupon was going away, and that nobody knew what the fuck compound was. And I'm sorry, like, but I didn't mean to cuss. Like, my dad told me not to say that. But like, honestly, like that's very much like, I was so tired of it. And I got mad at the obesity doctors, and I was like, I need you to come forward. You're obesity specialists. You've got to tell us what equals safer. What is about it? What is possibly not safe about it? Because people are going to do it. So if you don't tell them the safer places to go, they're going to go to the cheaper places, and they're going to get sicker. And so I feel like if you're an obesity specialist, you do have because there's not enough of them, right?
That's right.
An obligation to come forward and to educate as much as possible, because this gap is so large. And so whether that's on this show or on your own TikToks or wherever, but I just think it's really important. But the fact that we have come from that side of TikTok, where we didn't even know what compound was, to 2.5 years later, there is a huge, to startup, like, or whatever you say, like company, like big company, right? That is talking about not only the brand name, but compound on the Super Bowl.
Exactly.
So my little heart was more excited about that massive transition than I was about anything. Everything else, I was like, that's the next conversation.
That's the next conversation. That's right.
right? Because you
That's
can't
right.
solve it in a 30-minute or a 30-second ad. You can't do it all right, but you do have to play to the bias that people
There you go. There you go. That's exactly
that's
right.
what they did.
So yeah, so that's my take. I agree. I
It was
agree
kind
with
of
everything.
brilliant, but also
Yeah.
a little irresponsible.
Yeah, it was like, I'm
A
like,
little bit, yeah.
I'm like, you guys almost nailed it. Like you
What?
almost
Am I okay
nailed
with it? Yes, I am.
Yeah, but I'm like, you should have done this, you
Right,
know?
almost. But that's because we know so much more. So they're hitting us at an education level that the majority of America's not, right? Just like the people I was interviewing at Pont City Market, right? They didn't have any idea when I said GLP-1s. They knew Ozempic for weight loss.
That's
So,
right.
and their numbers are way up. Dave said
And I
8% up.
want you guys to think about it. We're
Yeah.
all talking about it, aren't we? I can't tell you. I've had at least 3 to 4 people this week
Yeah.
telling me, Michelle, you need to go watch this ad.
Yeah.
So
Mhm.
so I'm like, so if you guys were trying to bring attention, you actually were successful at that
They did. Yeah.
On one of the biggest stages.
on one of the
Biggest.
biggest stages,
Yeah.
right? Yeah, exactly.
And like
But-
mainstream, like a stage where everyone is sitting around popping popcorn and eating snacks and chugging beers, all the things not metabolically awesome for you. You know what I'm saying? And watching it. Like, you know what I'm saying? People go like there are people don't Super Bowl.
Uh-oh.
They
There
just
we go.
watch it for the commercials. You know what I'm saying? Like that's a thing.
Especially before the halftime show,
Yep.
the placement, because that's more expensive. They knew exactly what to do.
They know what they're doing.
Yeah.
Mid-roll, y'all. Mid-roll.
Mid-roll. There you go. Mid-roll.
Advertisers, it's why I charge you more for mid-roll.
That's exactly right. So yeah,
This has
no,
been
you guys.
such a good conversation. We definitely need to have a part 2. We'll ask everybody in the comments to tell us that too, so we'll make sure we'll do it.
Yeah, send us some
I
questions.
am really think of the engagement. And I really want you to talk to us about the name of your podcast, where we can find you on socials, so people can go and follow you if they want to sign up for coaching or anything like that. And then you send me those links, and I will put them in the show notes so people.
Absolutely. I
Okay.
absolutely will. But yeah, so yeah, Dear Healthcare Provider is on any place you listen to podcasts.
Or
It's
watch.
on Spotify, it's on Apple Podcast, and you can watch it on YouTube if you want to do that. So season
Awesome.
1 is up, and
Oh, and
you
look it
guys
up.
can have at it. And I'm at Coach Tedder on my socials. And I think Instagram, I might be Michelle Tedder. That's my more stuffy professional side.
I get that. Michelle.
Right. I'm Michelle Tedder, MSN-RN on there. But anyway, but I'm just Michelle.
I love it.
Yes.
Awesome. Well, this has been great. I think
It
we've
has been
covered a lot.
awesome. Thank you, ladies.
And we'll talk more. I think there'll be more conversations to come this year that are very important around, bias and DEI, especially since this commercial and
Mhm.
society and compound and all of these things. And it would be so cool to have you back in a couple months. and
I
be
would
like,
love to. I would love to
"Man,
anytime.
where we've come. Like if we come back like in the summer and we're like, look how far we've come. Like,
Yes,
hopefully
yes,
that's the conversation. Look how far we've come, or look how
yes.
much further we need to go, or hopefully examining both,
That's right. And it'd be fun to maybe do some lives in between together.
Absolutely.
I
I
would
would
love
love that.
Mhm.
Yes.
That would be so much fun.
So fun.
Mhm.
I love that idea.
Mhm.
Okay.
Yes.
All right,
Well,
everybody. Thanks
you.
so much for coming today. And we will see you
Absolutely.
next week. And don't forget to check out in the comments and follow Nurse Tedder everywhere. And definitely listen to her podcast. If you're listening to our podcast, you're podcast people. So go follow it. It's important. Awesome.
you.
Hasta la pasta.
Pasta.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper, with results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not 1, but 2 hormones to curb hunger and nausea. Weight loss faster, confidence higher, price cheaper. See if you qualify at ro.co/TV.
Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus SideZ Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. the Plus SideZ Podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus SideZ Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus SideZ Podcast. You're not alone. It's not your fault.